Welcome back to the lecture series on periodontics. In this video, we will be continuing our discussion on trauma from occlusion. Repair phase is the second stage of the tissue response. So during the initial phase or the injury phase, what happens? There is damage to the periodontal structures. So what are periodontal structures? Cementum, alveolar bone, and the periodontal ligament. So the cementum was lost in the injury phase. So in the repair phase, new cementum is formed in order to restore the injured periodontium. And when it comes to the alveolar bone resorption has happened in the injury phase. So in the repair phase, body tries to compensate the lost bone and it forms new bone. And when it comes to the PDL, periodontal ligament is damaged in the injury phase, whereas in the repair phase, body tries to remove all the damaged tissue and it produces new connective tissue cells. So the newly formed cells try to restore the injured periodontium. When you take the alveolar bone, in the injury phase, alveolar bone resorption has happened. So in the repair phase, body tries to compensate for the lost bone and forms the new bone, which is known as buttressing bone formation. So buttressing bone formation can be of two types, central and peripheral. Central buttressing is seen in the jaw, whereas peripheral buttressing is seen on the bone surface. Peripheral buttressing happen on the facial and the lingual surfaces of the alveolar bone. So this is the facial surface of alveolar bone and this is the lingual surface of alveolar bone. Usually peripheral buttressing are seen in these two areas. Peripheral buttressing can cause the thickening of the alveolar bone margin and this is known as lipping, and in some cases it is not like lipping, it is producing a bulge on the peripheral surface. It is producing a bulge on the peripheral surface. So this is about the repair phase of the periodontium. Next, let us understand about the adaptive remodeling phase of the periodontium. So if the repair process is unable to cope up with the destruction process, then periodontium is remodeled in order to create a structural relationship in such a way that again it is not subjected to the injurious forces. So for this, what does the periodontium do? It is causing the widening of the periodontal ligament. So this widening is happening in such a way that it is funnel shape at the crest. And you see angular bony defects are formed in the bone. And also you don't see any pocket formation. There is no periodontal pocket formation as junctional epithelium is not getting affected here. And there is also increase in the vascular supply. Till now, we have discussed about the excessive occlusal force. Next, let us discuss about the insufficient occlusal force. So normally, let us assume that X is the amount of the force that is normally falling on the tooth. And Y is the amount of excessive occlusal force. And Z is insufficient occlusal force. So when excessive occlusal force is applied onto the teeth, you have seen that injury, repair, and adaptive remodeling of the periodontal structures happen. When there is insufficient occlusal force, let us see what happens to the supporting periodontal tissues. Is it injurious? Yes, insufficient occlusal force is also injurious to the periodontium. So if the forces are not adequately applied onto the tooth, you see the periodontal ligament is getting thinned and you see the atrophy of the periodontal ligament fibers. If there is no proper amount of the force, the functioning of the periodontal ligament is not proper and you see the atrophy of the periodontal ligament. And alveolar bone also is not in a normal state. You see osteoporosis. If the bone is not subjected to enough amount of force, so what body think is, so there is no use for the bone in that region. So osteoporosis is getting initiated. So you see the atrophy of the fibers and osteoporosis of alveolar bone. And you see the reduction of the alveolar bone height. So when do you see this insufficient occlusal force? When the occluding teeth is absent or in cases of open bite or in cases where there are unilateral chewing habits that are neglected on one side of the mouth. So some patients will be chewing on only one side and they'll not chew on the other side. In those conditions also, you can see this kind of changes in the tooth. So this is about insufficient occlusal force. Next, let us understand about the reversibility of the traumatic lesions. Definitely, trauma from occlusion is reversible. When you relieve the occlusal force, which is causing the injury to the teeth, automatically the periodontal tissues undergo the repair and they try to get back to the normal. So if there is any periodontal inflammation, in that conditions, the reversibility is getting impaired. So you have to treat it accordingly. So it may impair the reversibility of the traumatic lesions.
If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.